Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Living with HIV/AIDS. Introduction. Infection with HIV/AIDS is serious, but the outlook for people with HIV/AIDS is improving as healthcare providers learn more about it. If you are living with HIV/AIDS, it is important to make choices that keep you healthy and protect others from becoming infected. This program explains living with HIV/AIDS. It explains what HIV and AIDS are, how to take care of yourself if you are living with an infection, and how to avoid risky behaviors that could spread the infection to other people. HIV/AIDS. HIV stands for human-immunodeficiency-virus. HIV kills or damages the body's immune system cells. This destroys the body's ability to fight off infections. AIDS stands for acquired-immunodeficiency-syndrome. It is the most advanced stage of infection with HIV.
The first signs of HIV infection may be swollen glands and flu-like symptoms. These may come and go a month or two after infection. Severe symptoms may not appear until months or years later.
People who have AIDS have a weak immune system, and their body cannot fight off disease very well. Early signs include extreme tiredness and fever. During later stages of AIDS, pneumonia or cancer may develop, which can ultimately lead to death. There is no cure for HIV/AIDS, but there are many medicines available to treat symptoms. These medicines fight both HIV and associated conditions.
Millions of people worldwide live with HIV. Thanks to better treatments, people with HIV are now living longer and with a better quality of life than ever before.
If you are living with HIV, it is important to make choices that keep you healthy and protect others from becoming infected. Treatment for HIV. Finding out that you have HIV can be scary and overwhelming. Try to remember that you can get help and that these feelings will improve with time. Soon after your diagnosis, your provider will run tests to determine how well your immune system is functioning. Your healthcare provider may test you for other diseases that are associated with HIV. There is no cure for HIV or AIDS, but there are drugs that can slow down the damage done by the HIV virus, and that can allow the immune system to recover. Anti-HIV drugs work because they attack the HIV virus directly. The drugs may prevent the virus from making copies of itself. There are different kinds of anti-HIV drugs. Each attacks HIV in its own way and helps your body fight the infection. Most anti-HIV drugs come as tablets or capsules. Several of these drugs may be combined into one tablet to make it easier to take your medications. These are known as fixed-dose combinations. If you follow your healthcare provider's instructions about how to take your medicine, the anti-HIV drugs may lower the amount of the virus in your blood. If you miss doses or you do not follow a regular schedule, the level of the drug in your body goes up and down. The virus then has the chance to make copies of itself in your body. Following your treatment schedule also helps to prevent drug resistance. If you miss a dose, the virus may make new and different types of itself that the drug can no longer fight. HIV medicines may cause side effects in some people. It is important that you tell your healthcare provider right away about any problems you are having with your treatment plan. Keeping a medication diary can help you keep track of problems.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Nutrition. Having good nutrition means eating the right types of food in the right amounts. It is especially important for someone who is HIV positive to eat a nutritious diet. This can support the body's immune system and overall health. Your immune system needs energy to fight off infections. You may need to eat more food than you used to in order to get the calories you need for your body to do its job. If you are underweight or have advanced HIV disease or other infections, try including more protein in your diet. You also may benefit from extra calories from carbohydrates and fats. Drinking enough liquids is important when you have HIV. Fluids transport the nutrients you need throughout your body. You should get at least 8 to 10 glasses of water or other fluids a day. Other fluids include juice or soup. People with HIV need extra vitamins and minerals to help repair and heal cells that have been damaged. Your healthcare provider may recommend a vitamin and mineral supplement. While vitamin and mineral supplements can be useful, they can't replace eating a healthy diet. Only use vitamin and mineral supplements as recommended by your healthcare provider. Exercise. Regular physical activity has lots of benefits. It increases your physical strength and endurance. It can also help prevent problems like high cholesterol and diabetes. Experts usually recommend 30 to 45 minutes of exercise a day. If you are living with HIV/AIDS, it is important to discuss an exercise routine with your healthcare provider before you begin. Together, you can develop an exercise routine that is appropriate for you and reflects your HIV care plan. You will also want to maintain a healthy weight and healthy eating habits. When combined with an appropriate exercise routine, this type of lifestyle may help prevent other health problems. Avoiding risks. HIV is spread through body fluids such as blood, semen, vaginal fluids, and breast milk. HIV is most commonly passed from one person to another through unprotected anal or vaginal sex, sharing needles or other drug equipment.
The amount of HIV in your blood can range from undetectable levels to millions of copies. This is known as the viral load. The higher your viral load, the greater the risk of spreading HIV to others. Having a low viral load reduces the risk. If you have maintained an undetectable viral load, you have effectively no risk of spreading HIV to a partner during anal, vaginal, or oral sex, but you can still spread the virus through shared drug needles or syringes, breastfeeding, and childbirth. Take all of your medicines and get tested and treated for other sexually transmitted infections or STIs. If you have HIV plus another STI, you are 3 to 5 times more likely to spread HIV than if you only have HIV. Either practice abstinence or use condoms whenever you have vaginal, anal, or oral sex. Abstinence means not having sexual contact with another person. You may not need to use condoms if your viral load is undetectable. Ask your healthcare provider for more details.
Do not share drug equipment. Blood can get into needles, syringes, and other equipment. If the blood has HIV in it, the infection can be spread to the next user. Do not share items that may have your blood on them, such as razors or toothbrushes. If you have a newborn, avoid breastfeeding. Do not pre-chew your baby's food. Drugs and alcohol. HIV medications are hard on your body. For the HIV medications to work best, you should avoid drugs and alcohol. Smoking a substance of any kind irritates your lungs. Smoking may increase your risk for serious lung infections. Recreational drugs, such as cocaine or methamphetamine, can leave your body dehydrated and exhausted. They can also lead to skin irritation. All of these things can make it easier for you to get infections.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary.
Millions of people worldwide live with HIV. Thanks to better treatments, people with HIV are now living longer and with a better quality of life than ever before.
If you are living with HIV, it is important to make choices that keep you healthy and protect others from becoming infected. There is no cure for HIV or AIDS, but there are drugs that can slow down the damage done by the HIV virus and allow the immune system to recover. Having good nutrition means eating the right types of foods in the right amounts. It is especially important for someone who is HIV positive to eat a nutritious diet. This can support the body's immune system and overall health. If you are living with HIV/AIDS, it is important to discuss an exercise routine with your healthcare provider before you begin. Together, you can develop an exercise routine that is appropriate for you and reflects your HIV care plan. HIV medications are hard on your body. For the HIV medications to work best, you should avoid drugs and alcohol.
Thank you for using Explain.